Hey everyone, and welcome to our guide on the ear examination part 1. This is really geared towards undergraduate students, so if that's you, you're in the right place. We're going to break down the absolute essential first steps for doing a proper assessment, focusing on the external ear. All right, let's jump right in. Okay, so let's start with a question. Before you even pick up an instrument, before you do anything physical, what do you think is the absolute #1 first step of an ear exam? Go on, have a think. The answer might actually surprise you. It happens before you even look at the ear.
Yep, it's that simple. Listening. A truly great clinical examination always starts with taking a really thorough patient history. You have to understand their complaints, what symptoms they're having, what their story is. That's the foundation for everything else you're about to do.
So today we're going to walk through 5 main stages. First, we'll cover how to prepare for the exam. Then we'll get into inspecting the outer ear itself. After that, we'll cover checking for tenderness, then identifying some key anatomical landmarks, and finally, how to get a good, clear view of the ear canal. Think of this as your roadmap for the whole external exam.
All right, first up, preparing for the examination. Seriously, getting this part right is absolutely crucial. It's the foundation for a successful exam, and you just can't skip it.
So, right after you've taken the patient's history, the very next thing you need to think about is positioning. I know, it sounds super basic, right? But trust me, this little detail has a huge impact on how well your examination goes. You've got to make sure both you and the patient are positioned correctly. It's all about stability and comfort.
And this really shows what I'm talking about. Proper positioning, right down to where you place your legs, gives you that critical stability you're going to need to keep your hands steady later on. It's all about creating a stable, totally controlled environment before you even begin.
Okay, with our foundation all set, let's move on to the next phase, inspecting the outer ear. I want you to think of this as a systematic visual sweep. You're basically a detective, looking for clues on the surface before you go any deeper. Now, what are you actually looking for? Well, you're scanning for things like preauricular pits. Those are those tiny little indentations you sometimes see near the front of the ear. They're actually pretty common congenital findings. You're also on the lookout for any scars, which might give you a clue about past surgeries or injuries, and of course, any obvious swelling or, anything else that just doesn't look right.
And the key here, really, is to be thorough. Don't just give the ear a quick glance. You need to do a full 360-degree inspection of the pinna. That's the whole visible part of the ear. Make sure you check the front, the back, and all the areas surrounding it.
All right, so we finished our visual sweep. Now it's time to move from just looking to the first hands-on part of the exam, checking for tenderness. This is a really important diagnostic step.
So the main thing we're checking for here is something called tragal tenderness. And you do this by gently but firmly pressing on the tragus. That's that little piece of cartilage right there in front of the ear canal. The patient's reaction to this press is going to tell you a whole lot.
And here's why that simple little press is so important. If the patient feels pain when you do that, it's a classic telltale sign of otitis externa. That's just the fancy clinical term for an outer ear infection, what most people call swimmer's ear. So see, this one simple action can point you straight towards a potential diagnosis. Okay, next up, we're going to get even more specific with our hands-on check. We're going to be palpating or feeling key anatomical landmarks around the ear. Knowing your way around these specific points is absolutely essential.
So one of those key spots is the cymboconcha. It's the narrow upper part of the concha, that shell-like part of your outer ear. It's located really close to the tragus, and checking for any tenderness right here is a standard part of the procedure.
So, to recap, here are your 3 main targets for palpation. First, the mastoid tip. That's the bony bump right behind the ear. Pain here could be a serious red flag for infections like mastoiditis. Second, the cymboconcha, which we just pointed out. And finally, the zygoma, which is your cheekbone as it gets close to the ear. And now for our final step in this external exam, getting ready to actually view the ear canal. The goal here is simple, but it's so important. You need to create a straight, clear path for your line of sight. The technique itself is a really simple 2-step move. You're going to gently take hold of the upper part of the pinna, and then you pull it upwards and outwards. It might feel a little strange at first, but this movement is absolutely critical for what comes next. And here's the why behind it, the actual anatomy. See, in an adult, the ear canal isn't perfectly straight. It has a bit of a curve. So by pulling the pinna up and out like that, you are physically straightening that curve. You're lining up the outer cartilage part with the inner bony part, and bam, that gives you a direct, totally unobstructed view right down the canal. So now that you've got that clear view, what are you looking for? Well, you're inspecting the canal for anything that's blocking the way, like wax. You're looking for signs of infection, like any discharge. You're checking for foreign bodies. You'd be surprised what can end up in there, or any other visible issues like redness or swelling. And super important, document everything you see. And just like that, you have now completed the external ear examination. That's it. From taking the history and getting the patient positioned correctly, all the way through the visual inspection, checking for tenderness, and finally getting that clear view of the canal, you've now covered all the essential groundwork.
So, you've done all this prep work. The path is clear. You have a direct line of sight down the auditory canal. The big question now is, what's next? Where do we go from here?
Otoscopy. It's time to pick up the otoscope and actually look inside. And that is exactly what we're going to cover in part 2. Thanks so much for joining me.